Yeah, so quite a few of you are messaging me, asking me, okay, look, this MMI interview thing, what is it? What can I expect on the day? What can I expect on the day? How does it work? So this is specific to UK Medical and Dental School MMI interviews, and I hope you find this useful. It's a great topic to kind of, I guess, prepare you for the day. So MMI, multiple mini interview. That is the dominant interview format, and it is used by most medical and dental schools in the UK. It is highly structured, and it's designed to assess your non-cognitive skills and professional attributes in a number of short but highly pressurized scenarios. So what is the MMI format, I hear you ask? Well, the format is structured like a circuit, like a carousel. Instead of having like one long interview, like some universities do, whether it's your Oxbridge and a few other universities in the UK who still do the panel system where you're facing between 2 and 4 interviewers in one room. What the MMI does is you're kind of going between stations, room to room if you like, all right? And each station can last between 6 and 12 minutes, depending on where you apply to. So as I say, the total number of stations are between 6 and 10. Make sure you find out. Ask the school before the interviews, and quite often they tell you anyway. But make sure you know how many stations to expect, how long each stations are for, okay? And as I said to you, they're between 6 and 8 minutes usually. And again, in terms of prep time, they may give you 1 to 2 minutes outside of the station or within the station so that you can prepare. You can prepare your answer. You can ask questions potentially to the interviewer in case you don't understand something. So overall, if you do your maths, what you'll find is that the questions will take between an hour to an hour and a half. But what you'll find is you need to arrive much earlier so that you can then be ushered into groups. And also what you'll find after the interview, you'll be ushered into certain groups. When I went to the interviews not so long ago with my own daughter, we were there like all morning. We were there at about 8 in the morning, and we were there until just before lunchtime, because the time it takes to be ushered, then the circuits, and then of course afterwards, the time it takes for the students to come out, and then you can exit the premises, you're talking maybe 3-4 hours quite easily. So be prepared to come across that. So in terms of format, the MMI day, it's like a circuit. It's like a carousel, if you like. Instead of sitting in a panel interview where you're facing between 2 and 4 people in front of you and they're asking you the questions one after the other, you're essentially just changing interviewers, changing rooms, going from one room to another, one station to another, change of topic, change of question, and it's like that. So in my opinion, there's actually a lot of similarities between the two models. And so in terms of numbers, as I said before, it's between 6 and 10 stations, 6 and 10 rooms. And in those rooms, you'll probably spend between 6 and 8 minutes, depending on which school you're being interviewed at. And in total, if you do the maths, it will be about between an hour and an hour and a half long. But expect to be there perhaps for about half a day, because by the time they take you in, by the time they let you out, so that kind of there's no mixing with other groups, etc., and the organizational and the logistic aspects of it, you'll probably be there for half a day. And so each station, as I said, it's run by a different assessor. That could be a doctor, that could be a student, that could be an academic from the university, that could be a member of the public, it could be an actor there as well. You're being interviewed by multiple different people who are potentially from different academic and career backgrounds. And this is supposedly making the whole process fairer, the assessments more matrix-based, and therefore fairer and more objective. So let me run you through stage by stage how the day will feel like, how the day will see. So I mentioned reading time, usually about 2 minutes before. you're kind of standing outside the room or perhaps just inside. The stations are numbered, all right? There may be a sign on the door, and you'll see there's kind of written prompts on what to do and what the scenario is about, what the question's about. You're going to use that time to read the instructions, you'll understand the task, and formulate your thoughts. And I find that kind of 2 minutes is ample time, very good time to formulate and to get a good kind of idea of what you're going to do and say in that station. And then you'll hear the bell ring, okay? And that means you enter the room. It signals the start of the interview, and you'll greet the assessor, the interviewer, and you'll start to begin your task, your discussion, if you like. When the second bell rings, it usually means that the task has come to an end, and it marks the kind of end of the station. You need to stop, you can't continue, you need to thank the interviewer, and you need to quickly exit so that you can get ready for the next station. It's very important that you don't dwell, you don't apologize, you don't kind of try to make up for mistakes, etc., that you might perceive to have made during the actual task, because you're only wasting your time. They can't mark you, assess you beyond that buzzer, beyond that bell. You really need to move, because you need to also prepare for the next station, remember. So make sure you don't dwell, you don't kind of think about what you've just done. Think about what you're going to do next. I talk to my students all the time about these stations and what they can expect. And if people come to my course, we really go through what I call the high yield topics. Generally, what I find is I can divide these stations up, these topics up in different areas. They're really grouped up so that they can test different core skills required of you as a doctor, as a future professional. And really, there's a lot of reference to the good medical practice documents, or for the dentists, the GDC statements. There are stations that will look at motivation and insight. And these are quite kind of evergreen, long-term. They've always been there, i.e., what's your drive? What's your personal qualities like? Do you understand the profession? And it might be questions like, why medicine? And that's why I have so much emphasis on those questions during our Blue Peanut courses. You'll then have the other category of questions that kind of focus on ethics and moral reasoning. And often these are done as scenarios. Either you discussing the scenarios, or you might be role-playing them. And this is where you're presented with often a difficult, an involved scenario, if you like. I wouldn't say difficult in the sense that you can't tackle it. No, you should be able to tackle it. With plenty of practice, plenty of revision, plenty of knowledge base, you should be able to manage it fine. But it's meant to be a bit challenging. And it's meant to be a scenario that kind of tests how you react. Are you showing a balanced understanding, ability to reason, ability to be non-judgmental, if you like? It's about focusing your ability to weigh up competing principles. So if you look at it ethically, what are the key ethical pillars that come in, i.e. autonomy of the patient, autonomy of the doctor, how you balance the two out. And are you thinking logically? Are you thinking about the different stakeholders involved? It might be patients, it might be carers, the family, it might be you. Well, sure, there'll be somebody involved, either you, there may be other clinicians, doctors, dentists involved. There may be, from an organisational perspective, the practice, the hospital, the government, public health. And of course, as I said, there's always an evergreen hook here, which is ethics, And don't forget, there's also the lifeblood. The lifeblood of these scenarios is empathy, in my opinion. You've got to show empathy both verbally and non-verbally. And we spend a lot of time in our courses talking about this and how to structure so that you can come across and you think about all these different elements of thinking. There's, as I alluded to, the role plays. Some of these scenarios are tested as role plays. So these are like communication stations, if you like. And they require you to kind of think and interact in a simulated manner. So guys, get in the role, get in the moment, start being an actor, because actually that helps. It's playing a role of perhaps you in the scenario, perhaps you as a doctor, perhaps you as a dentist, and you might get scenarios where it's like, say, a worried patient or a challenging colleague. And it's often done using an independent actor in the room, or it could be the assessor themselves, the interviewer themselves. And these kind of scenarios are designed to test your ability in terms of focusing on your empathy, clarity, diplomacy, ability to break important news like bad news, ability to take history and have that conversation. And in a scenario, an example would be, for example, you've got however long the station is, that many minutes to explain a complex diagnosis, or discussing with your patient about the need to go and investigate something, or about managing a distressed person or a distressed member of family. All right, it might be about counseling somebody who isn't happy or who's going through difficulty. All right, like a friend maybe who's drinking too much alcohol. There's other areas of stations that kind of focus on teamwork, that focus on collaboration. And these can be practical and instructional. These stations are often involving working with other people in the scenario. Some universities even test you by putting you into group stations, right? And kind of seeing how you interact in that situation. The focus here is your ability to kind of give and receive instructions in many cases. It's important to be clear. It's important to kind of possess and kind of display good leadership skills, patience skills. You can listen as well as you can interact and show direction. And also about recognizing limits, right? An excellent clinician is somebody who also works within their level of competence. So an example would be, for example, you're given instructions to build a structure, perhaps with Lego, perhaps with pipe cleaners. These are things we've seen in the past. Not so much since COVID, but I can see these things coming back. I'm certainly seeing stations where you're asked to do tasks and so forth, whether that's individually or as a group. In a group, of course, there's other elements coming in. You need to show elements of leadership, diplomacy, being able to listen, being able to take instructions, and also give instructions and give ideas to other people around you. There's also the critical appraisal questions, and I cover numeracy data stations in my course, and I talk about why they do it. Because as future doctors, as future clinicians, as future dentists, you need to be able to read, you need to be able to interpret, you need to be able to discuss information in front of you, whether that's in a journal article, whether it's a guideline, whether it's a protocol. You need to be able to show that you can critically think. You can, show an element of ability around numeracy and analyzing of data. So it might be a graph, it might be a journal sheet you're given, and you have to derive kind of conclusions from it. It might be describing a picture, it might be describing a map or something like that to kind of see whether you have the ability to take and give instructions. All right. So they come in different forms, different shapes and sizes, but they're testing your ability to read, interpret, and show an ability of critical thinking, I guess. So my final tips to you would be around, practicing lots. And I find the more you practice, the better you get at articulating your answers within those 6 minutes, within those however minutes you might have. I think towards the end of your practice, say a few weeks before the interviews are due, start to time yourself, put a stopwatch on, time yourself whilst you're giving answers, whilst you're practicing with somebody. It's important not to rush. You actually find that you can speak slowly, you can articulate very clearly, very wisely, within the allocated time, without having to rush, without having to be unspecific and unclear about your answers. Be reflective in the way you come across, talk about experiences, use various techniques to go back to anecdotes and derive lessons from it, and how that kind of takes values out of it, and how you can talk about it, for example. Be focused as well. Don't be wishy-washy. Having a structure helps. I talk about structure all the time. If you were to attend my courses, you'll see that I talk about different types of structures and how it's so important, because the interview is and can be quite stressful. And in those situations, you've got to manage stress well. And one of the ways you do that is with really good prep, but also with really good structure to your answers. All right. So remember, look at structure. And also, don't forget, I keep saying to people, wipe the slate, wipe the slate, wipe the slate. What I mean by that is, once a question's done with, whether it's in a panel environment or whether it's an MMI circuit, when the next question comes along, you got to move on. Don't dwell on the past. Whatever you've said, whatever you've done, that's what they're going to mark you on. What you do afterwards doesn't change anything. Move on, wipe the slate, start afresh, stay focused, and you should be fine.